The city of Denver decided to try something new. Instead of armed police officers, the city's been sending mental health professionals to certain 911 calls, hundreds of them. The city reports it's been a huge success, 0 arrests and no calls for backup. Other cities are now looking to copy Denver and the pilot program. Here's CNBC's Valerie Castro.
Snacks, waters, hygiene supplies.
Denver paramedic Spencer Lee checks the van he'll spend the day in, alongside clinical social worker Chris Richardson. The pair will work an 8-hour shift, responding to certain types of 911 calls rather than police.
Whether that be a mental illness, substance misuse, just a simple trespassing call, people experiencing homelessness, I'm there for medical triage.
The STAR program, Support Team Assisted Response, launched last year in the midst of the pandemic and social unrest. Denver Police Chief Paul Pazin calls it a success beyond what city leaders hoped it could accomplish.
This allows the officers to focus on what police officers are really good at, and that's violent crime, property crime, and traffic safety issues. For some situations, a uniform itself can escalate the situations. These individuals may be in crisis, but they're not armed with a weapon. They're not harming anyone.
As of last month, the program has taken more than 1,600 calls. None required police backup or resulted in arrests or injuries.
So call number 6 of the day was an individual that came across 911 as trespassing.
On this day, Chris and Spencer helped take a man to a homeless shelter while listening to his story.
He'd been a little bit burned by the system just in general and empty promises, and we talked about accessing case management services to be able to kind of hopefully restore his faith that support around him can actually be beneficial to him in the long run.
Another call, a suicidal woman at a city park.
She's a veteran with PTSD, and unfortunately there was a witness nearby that stated they saw her take an unknown amount of ibuprofen. So at that point we had to go the medical route.
And I think us being able to provide that support in the moment really empowers people. It makes them feel heard, it makes them feel respected, and gives them a little bit of dignity.
The program will now expand, adding more vans to the fleet, more shifts, and more teams to treat those in need. Denver modeled its program after a similar one in Eugene, Oregon. The Denver version has attracted interest from other cities, and representatives from St. Louis were there over the summer to get a first-hand look at how this all works. And Shep, New York City launched something similar just this past June.
Shepard Smith here. Thanks for watching CNBC on YouTube.